everyone. Let's talk about something that can be a little embarrassing, but is super common. Hemorrhoids. Yes, you heard that right. Hemorrhoids. It's a topic that many of us shy away from, but it's time to bring it into the open. We've all been there, right? That moment when you feel a little discomfort and wonder if anyone else is going through the same thing. Well, the truth is, you're not alone. That uncomfortable itch, the occasional bleeding after a bathroom trip, it's not exactly dinner table conversation, but it's important to talk about it. These symptoms can be alarming, but they are more common than you might think. You might be surprised to know that hemorrhoids affect millions of people, and they're nothing to be ashamed of. In fact, by the age of 50, about half of adults have experienced the discomfort of hemorrhoids. It's a part of life that many people deal with. Think of it this way. Just like any other part of our body, things happen down there. Hemorrhoids are simply swollen veins in the lower rectum or anus, similar to varicose veins you might see in your legs. They can be caused by a variety of factors, including straining during bowel movements, sitting for long periods, or even pregnancy. The good news is that most hemorrhoids are easily treatable, and with a little knowledge and care, you can find relief and prevent them from coming back. Treatments range from simple lifestyle changes, like increasing fiber intake and staying hydrated, to over-the-counter creams and ointments. In more severe cases, medical procedures might be necessary, but these are usually quick and effective. So, let's break down the stigma and get informed. By talking openly about hemorrhoids, we can help each other find solutions and support. Remember, it's a common issue, and there's no need to suffer in silence. Let's take care of our health together and make sure everyone feels comfortable seeking the help they need. Okay, so what exactly are hemorrhoids? Imagine the veins in your legs. Sometimes they can get swollen and a little bumpy, right? Well, hemorrhoids are basically just swollen veins, but they're located in your lower rectum or anus. Think of them like varicose veins, but in a different location. They can be internal, meaning they're inside the rectum, or external, meaning they develop under the skin around the anus. Now, you might be wondering, why me? Well, there are a few things that can cause those pesky hemorrhoids to flare up. One of the biggest culprits is straining during bowel movements. You know, when you're really constipated and have to push really hard, yeah, that can put a lot of pressure on those veins down there. Another common cause is pregnancy. As your baby grows, it can put pressure on your veins, increasing your chances of developing hemorrhoids. So how do you know if you actually have hemorrhoids? It's a common question, and one that many people are often too embarrassed to ask. Hemorrhoids, also known as piles, are swollen veins in your lower rectum or anus. They can be internal or external, and the symptoms can vary depending on the type. Well, there are a few telltale signs to look out for. Recognizing these symptoms early can help you manage the condition more effectively and seek appropriate treatment. One of the most common symptoms is bright red blood on your toilet paper or in the toilet bowl after a bowel movement. This can be alarming, but it's a typical sign of hemorrhoids. The bleeding is usually painless and occurs due to the swollen veins being irritated during bowel movements. Don't panic if you see this. It's usually nothing to worry about, but it's always a good idea to get it checked out by your doctor just to be safe. Other symptoms include itching, discomfort, and pain, especially during bowel movements. This discomfort can range from mild to severe, depending on the size and location of the hemorrhoid. Swelling around your anus is another common symptom. This swelling can cause a feeling of fullness or a lump near your anus, which can be quite uncomfortable, especially when sitting. In some cases, you might also experience mucus discharge or a feeling that your bowels are still full even after a bowel movement. If you notice any of these symptoms, it's important to consult with a healthcare professional for a proper diagnosis and treatment plan. Getting checked out, diagnosis, and your doctor visit. This section is all about understanding what happens when you visit your doctor for a diagnosis. If you're experiencing any of these symptoms, don't worry. There's no need to be embarrassed. It's important to remember that seeking medical help is a positive step towards better health. Doctors have seen it all, and they're here to help. They are trained professionals who understand that your comfort and well-being are their top priorities. During a typical checkup, your doctor will ask you about your symptoms and medical history. This helps them get a complete picture of your health and any potential issues you might be facing. They might also perform a physical exam, which may involve a gentle examination of your rectum. This is a standard procedure that helps them check for any abnormalities. Don't worry, it's quick and relatively painless. Your doctor will explain each step to ensure you feel comfortable and informed throughout the process. In some cases, they might recommend a more thorough examination, but we'll talk more about that later. Remember, your doctor is there to guide you through every step, ensuring you receive the best care possible. Relief is on the way. Treatment options for hemorrhoids. The good news is that there are plenty of treatment options available to help you find relief from hemorrhoids. For mild cases, simple home remedies can work wonders. One of the easiest things you can do is take warm baths or sitz baths, which is just a fancy term for soaking your bottom in warm water. This can help soothe the area and reduce inflammation. Prevention is key, keeping hemorrhoids at bay. Now that we've covered treatment, let's talk about prevention. One of the best ways to prevent hemorrhoids is to avoid constipation. Make sure you're drinking plenty of water throughout the day and eating a fiber-rich diet. Fruits, vegetables, and whole grains are your friends. Another helpful tip is to avoid sitting on the toilet for long periods. I know, easier said than done sometimes, right? But trust me, it can make a big difference. You're not alone. Seeking help and finding support. Remember, you're not alone in this. Hemorrhoids are incredibly common, and there's absolutely no shame in seeking help. If you're experiencing any discomfort or have any concerns, don't hesitate to reach out to your doctor. They can provide personalized advice, recommend the best treatment options for you, and put your mind at ease. Take control of your health. A positive outlook for a brighter behind. Dealing with hemorrhoids can be a pain, literally and figuratively. But with the right information and a proactive approach, you can find relief and prevent them from holding you back. Remember to listen to your body. Make healthy choices. And don't be afraid to seek help when you need it. Here's to happy and healthy bottoms for everyone.